I can't believe it. Again, I met a potential client here at the coffee shop, and they ended up going with someone else. Said they wanted to work with someone who looked more established.
Oh no, that's unfortunate, but honestly, why are you still meeting clients at coffee shops? You should check out J. Kenba Executive Suites.
J. Kenba? Never heard of it.
Really? It's a professional office space right here in Baton Rouge. You can rent an office that's already furnished, plus they include Wi-Fi, secure building access, utilities, on-site parking, and they even handle the regular cleaning. All you have to do is show up and focus on your clients.
Wait, they handle the cleaning too? That sounds way easier than trying to make my home office look professional or hunting for a quiet spot at a coffee shop.
Exactly. And if you don't need a full-time office, they even rent out conference rooms for small meetings and workshops. Perfect for impressing clients without the overhead.
That's exactly what I need. Where do I find out more information?
Just visit jkenba.com and schedule a tour. Trust me, you'll wonder why you didn't do this sooner.
J. Kenba Executive Suites. We provide the professional space. You create the success. Visit jkenba.com today.
Welcome to the Byja Radio Show. I'm your host, Dr. Byron Jasper, and we are recording live with special production by Becknell Media. All right, we are coming back in to the amazing Byja Radio Show. It is myself, Dr. Jasper, your host, and if I say we are coming back in, again, you already know who I'm talking about is in the co-host seat that holds us down and makes sure that this stuff is relatable. The gentleman who spares no expense whenever he comes out with all of his friends and family because he's just balling endlessly like that. I'm pretty sure that he has the endless collection of Jordans that other people would, sit there and just envy. And this is literally him just doing it on a Tuesday in my mind. So that gentleman must be the one and only Patient Zero. How you doing today, brother?
Man, what's so good, brother? How are you?
Doing good, man. No complaints. It's a new week, so we just getting in the swing of it, but no complaints.
Yeah, man. I got to be honest, man. When you said baller, you forgot three words behind baller. She said baller on a budget.
I was gonna say on a budget.
Yeah, man.
I figured that was gonna be.
I love. I don't know what's one of my more favorite things other than the coupon, bro. I love a deal.
In order of importance, is coupon and then everything else, or is it one thing before coupon?
It's like God, family, coupon. You know what I mean?
Not food, not water,
and everything else. Yeah, because I need to buy the food and the water with the coupon.
I like it, man.
I like something off. Give me something off, man. I'm ask for a discount every time, no matter what store I'm at. I could be making groceries. I could be buying a pack of T-shirts. I could be buying a suit. I don't care. Wherever I'm going, I'm asking for some type of discount.
I'm leaving here with something, right? What that was Denzel.
I'm leaving here with something. Look. I'm like, look. I bought this up here because I had intentions to buy this. However, if you could take something else off of this, that would be great.
And it works, I'm pretty sure, majority of the time.
It's about 50-50. And look, the Polo Factory store, it works more than not. I'm just letting you know.
And it don't hurt nothing. If they don't take nothing off, you kind of ain't no worse off than what you were.
Because I already agreed to buy it. Like, I bought it up there. I was like, I want this for this price, but let me see if I get something else.
There you go. It's a good talent to have. And I know everybody don't do that. And the fact that you do it regularly and it works, that just goes to show that's why you're here in the co-host seat, to make it, again, more relatable. Because, I could see some people saying, I relate to that. I really do. So.
Oh, yeah, bro. And look, another unsolicited tip for our listeners. One of my favorite things called price protection. If you buy something, keep the receipt. Like, if it's a paper receipt, keep it. Or if it's an eBay receipt, know where it's at and go to it. And you watch that product for about another 2 weeks. Most people will accept at least 14 days to 30 days of price protection. So if you bought something and the price went down like a week after you bought it, you can pull up and get the difference in the credit. They'll give you a refund of the difference or whatever, but you got to watch it. They're not going to fine you. You just got to know what you bought. Like I got a couple things in the closet right now. I've been looking because I want a refund back. I'm just letting you know, but that's free game for y'all since we're
And
talking about discounts.
and they're giving you a credit like a store credit, or are they giving you your money back?
Well, it could be a store credit, but 9 times out of 10, it's like money back on the original method of purchase.
Hmm.
So let's say you bought something, bought a blazer, $100 blazer. It went down 20%. You go back in the store a week later, you get your $20.
There you go.
That's gas money.
There you go. You're right.
I'm just saying.
And that's before the coupon.
Yeah, absolutely.
Ain't nothing wrong with
Because I probably didn't buy it without the coupon.
They go give you a credit and a coupon. There you go. That's a hustle, man. I ain't mad at it. So,
Hey, man, you got to do what you got to do.
well, to the business at hand, besides us giving people shopping tips and ways to keep money in their wallet, it's a perfect segue into keeping money in your wallet when it comes to healthcare. And last episode, or part one of why America needs direct primary care right now, I think we were very detailed in our, let's go ahead and say, evaluation of the traditional healthcare system. And I use the word evaluation as loosely as possible because I'm pretty sure it was an all out rant as to why the system is not really working and more importantly, why it's so bad. But we
It's definitely a rant.
evaluated it, right? We evaluated it thoroughly. And what we ended up coming up with, if you didn't listen to part one and you're jumping into part two, is that we didn't think it was going to take that long for us to evaluate the traditional healthcare system. But roughly an hour later, as we went through all of the problems and an hour worth of problems and criticisms, concerns, whatever you want to call it, we decided that we needed to make a separate second part to really talk about direct primary care because our intention was to do it all in one segment and
Yeah, it wouldn't work.
right, as I say, do one segment of why the bad traditional system is bad, and then a second segment as to why DPC is good. But it took so long to really go into how bad it was that we literally had to break it into two parts. So this episode,
And I think we cut it off at that
right?
because I think we could have made the problem part. We could have made it longer.
I don't think people realize that we literally stopped at I think an hour and 10 minutes, and we were like, we forgot like 15 things we could have kept saying, but we just said, I think they've had enough. So with part two, our plan is to do that deep dive into direct primary care with the hope that people will now have their questions answered about direct primary care in a way where it's not, well, what about this and what about that? We'll hopefully try to check all the boxes because people will tend to hear certain things, know that it's good, but then start to basically question and criticize, well, it doesn't do this, it doesn't do that. And I think as we go through this, it'll hopefully open a lot of doors, but also answer a lot of questions. So based off of that, patient zero, I know you're a huge advocate for direct primary care. We've talked about it quite a few times in different ways and basically alluded to it, but today is going to be that deep dive. So can you start off by giving people an idea of what is the definition of direct primary care in a very basic sense? And I mean, as simple as you can, what would you call direct primary care, just as a small one sentence way of explaining it?
So direct primary care is a healthcare model where you pay your doctor directly, usually in terms of a monthly subscriptions, and you get full access to most primary care services without insurance companies in the middle. So essentially, I pay you my membership fee on the first of the month. Something goes wrong, there's a specific number. I can text the clinic or I can get an appointment, no problem. My appointments normally last an hour and I can get care and you and I can discuss the methods of care and where we go forward, usually without the insurance having anything to do with anything.
Yeah. So I think you said it perfectly. It is basically a membership-based medicine model. And that's the way I usually frame it when someone calls the clinic and they're asking about making an appointment. Before we get started about scheduling an appointment, I say, well, what have you heard about direct primary care? And okay, if you haven't heard much about it, let me give you a short and sweet version before we go into a deep dive. It's membership based medicine where our patients, regardless if they have insurance or they do not, each of them pays us directly every month and they get access to medical care. The other way I frame it is it's like a gym membership for medicine, or it's like a Netflix for medicine. When you pay for a gym membership, whether you use it or you don't, you pay every month because you have access to the gym. Same thing goes for a streaming service. Most of them, whether you use it or you don't, you pay every month because you have access. So for us, whether you are potentially insured or you're not, whether you're coming in all the time or you're not, you're paying a flat fee each month to have access to medical care, and that's it. And the other part is it's not involving insurance companies at all. It's A to B, doctor to patient, patient to doctor. And then more importantly, it is something that's simple in that it's transparent because you're paying a price each month and you know what that price is. And Patient Zero already alluded to some of the things that we're going to talk about in terms of features of the membership, but ultimately you're a member in the practice. As a member, you get certain benefits, and with those benefits, we'll go into them and take a deep dive. And I think that's the biggest, most important factor of this model. Membership directly between the doctor and the patient, no insurance involved whatsoever. And it's a huge benefit when that happens, if I'm not mistaken, Patient Zero. Your thoughts on that? Do you think that makes sense for most people? Most people can wrap their head around it, I believe, correct?
Yeah, absolutely. And there's so many advantages in my opinion. But yes, it's a membership model. And basically because I'm a member of the clinic, there's a bunch of services that comes with my membership, services
Absolutely.
that I enjoy. And it's also I get a level of care that I haven't received before joining the clinic. So
All right.
it's something. It's a decision I'm grateful that I made.
So I think another thing we'll go into now that we've hopefully established a simple definition is what's included in most memberships. Now, I use the word
Sure.
most intentionally because every DPC practice is different. We say in direct primary care, if you've seen one DPC, you've seen one DPC, or you've seen one DPC practice, you've seen one DPC practice, because we all are different because we're not in this huge network like an insurance company where all of us, quote unquote, do the exact same thing because that's what's covered. If I have a certain specialty or a certain affinity for a certain population, I may specialize and really lean into taking care of that population. Whereas the clinic across the street, across the city, across the country is going to do something drastically different. The reason being is every doctor, every clinic has their own prerogative. So the membership has certain things that they will include at a baseline. And then some clinics may have other stuff they include or some stuff that they don't include. But we'll go over the
Hmm.
things that are basically covered across most, if not all, DPCs. So, Patient Zero, I'll let you start. How about you give us the first three, and then I'll come in and maybe give the second three or four, if that makes sense.
Gotcha. So, to your point, I think you're right. I can't really speak on DPC as a whole because I haven't gone to any of these conferences. I haven't done any extensive research. But what I can do and what I'm willing to do is speak on my experience at the Byja Clinic, which is my the clinic that I use for
Mhm.
my direct primary care experience. Right.
Well, let me jump in and say I think Patient Zero will be a hit at these conferences. I'm not saying that he has to come, but I think that at some point when he does pull up, the people are in for a treat. Whether it's a
I'll tell
live
you what,
episode,
man.
because the next DPC summit, right, the Direct Primary Care Summit, which is the largest direct primary care conference, is actually in New Orleans next year, my friend. It was in New Orleans this past year. You came out, held us down at our welcome event, so we appreciate you for making an appearance. But my point is, these people may need to witness the greatness that is Patient Zero. I'm just throwing it out there. That's all I'm saying.
Hey, well, maybe we might make that happen. Maybe you and I talk about our experiences on the panel, and maybe be able to talk. Maybe be able to pub the radio show. I don't know.
Yeah,
But let's make that happen because
yeah.
I never get tired of New Orleans. It's the best city in America. You
There
know,
you go. It's just a way to have an excuse to go hang out in New Orleans, right?
man, look, I go to New Orleans at the drop of a dime, bro. Like, and you be like, hey, man, I feel like take a ride. Let's go to New Orleans. I'm like, all right, let's roll.
That's why I said you don't really need an excuse, but this just gives you more of an excuse because now you're
Yeah,
working,
man.
right?
Yeah, put on a suit and look good and whatnot. You know, it's cool, man. Look like I know what I'm talking about. Yeah, let's do it.
There you go. There you go. All right. So let's go.
Yeah,
And like you said, give us those three, if not maybe four. I'm looking to see in the notes how many we got, but let's go at least with three.
I'm about to say I can run through them if you want, but um, the first benefit is unlimited visits, unlimited medical visits, and you can do those in person or virtual, which is a big deal because you've already paid the fee, so you get full access to the clinic, unlimited. Um, and like I always talk about, my appointment times are normally 30 minutes to an hour, usually closer to that hour, and we talk about everything. We talk about my, physical health, obviously. We talk about my latest labs. We talk about my height, my weight. We talk about my mental health. We talk about my optometry experience. We talk about making sure I've been to the dentist. Like we talk about all levels of care in those experiences in that hour, making sure that I'm engaged with my other providers as well. So it's a very a full circle holistic care in terms of uh, you're not just concerned with my labs or my blood sugar or my feet or my joints or anything like that. I get that experience of every part of my wellness matters. And that's something that we actually got time to do
Mm-hmm.
in these extended appointment times. Um, Something else we complain about in the traditional sense is actually being able to see your PCP, and a lot of times urgent care is needed because you can't get to them. Well, at the Byja Clinic, I get same day or next day appointments. So if I'm feeling terrible, I can just get to you. Or if I need something instantly, I can go ahead and text the clinic line, and I normally get a response within an hour. I don't have to go to urgent care anymore. So it's a huge benefit. So
Mm-hmm.
I'm saving money from making less trips,
Mm-hmm.
but I'm also getting fast, efficient, and a high quality of care,
Mm-hmm.
which I really like.
Yeah. So to clarify, patient zero actually knocked out four of them. And like I said, we have a very common list, but the common list extends to a certain point where as we go on, you'll hear some stuff that we may be able to do that other people can't do in different areas, different states and things. But I'll cover the four that he did. So unlimited medical visits in person or virtually, extended appointment times. So most appointments for us are 60 minutes. Some clinics, they may do 30 minutes and consistently do 30 minutes and then some 60-minute visits. But for us, we pretty much stick with 60 minutes because I like taking my time and I like having good conversation with our patients. So I usually don't do 30-minute visits. The reason why I say I usually don't, your visit can end before 60 minutes. It's not like you got to sit there for 60 minutes just because I want you to, but we always allot 60 minutes where if a person says, look, I got to go because Dr. Jasper running his mouth, that happens sometimes. I'm just saying.
We we finished in 30, but you got to keep me company.
Right, exactly. Right. That would be really awkward if people had to deal with that. But I will say, because I do talk a lot, people tend to not realize that it's been 60 minutes. And on the other end, depending on what we're talking about, especially if you're doing really well, we start talking about all kind of stuff, right? Like it's not just health related in the sense of we have to talk about medicine. It's health related in the sense that sometimes it's just good to have a good conversation, to share how you're
Yeah.
feeling, what you're thinking, what you're dealing with. So those 60 minutes allows you to, in essence, take that armor off and decompress sometimes. So that is huge. And I think that's a huge thing that shouldn't be understated. Same day or next day appointments is number 3, because a lot of clinics don't have the ability to do a same day or next day appointment without them bursting at the seams, because of course they're already overloaded and double booked and triple booked in different slots. We don't have that problem because we have it set up to where we don't double and triple book for that same day or next day appointment to be available for our members or our patients. And number 4 that patient zero mentioned, where he wrapped it in, is direct communication with the doctor. So he mentioned that with his membership, he can text, call, and even email, and it comes directly to me, the physician, where if you have a problem, you have a need, you have a question, you just reach out and it comes to the doctor. So those 4 are pretty common across the board for any DPC practice across the country. I mentioned that because, again, we may do it differently, right? Where one thing may be similar but not the same. You may all have extended appointments, but some may have 45-minute appointments. Some may have 30-minute appointments, and others have 60. That extended appointment concept is pretty common. Some people may have more text and phone call, not email. Some people may have more phone call and email, not text. But pretty common across the board, you're going to communicate directly with the doctor, and so on and so forth. But those 4 are pretty common across the board. And patient zero, I believe you, again, highlighted it, that you really and truthfully think those 4 are pretty good because it's not only saving you time, but it's also saving you money. Am I correct about that?
Absolutely. And we've already discussed, I don't like to spend a lot of money on anything.
Well, we don't have Byja coupons yet, but I know if we do, it may have a patient zero face on it. That's all I'm saying.
It should. I'm about to say I deserve that much.
It should be what is it, trademark that patient zero coupons are a thing at this point.
Can we make like a free consultation coupon with my picture on it? Can we do that? And it'd be green.
I think that could actually work, because we have a consultation calendar where people can do the meet and greet for free. And I think if that literally was a thing where people would say, well, who's this guy? It would be a perfect segue, like, oh, you got to listen to the podcast because patient zero is a phenom, right? Like he's a phenomenon
Yes.
across the board. So I think that's actually a thing, man. We have to invest in that and maybe see what that looks like, and then have different iterations of it. Whereas like year 1, it's one color. Year 2, it's a different color. So we start to like rotate to know what year you joined. Like if it's the 4th year, it's this color. If it's the 5th year of the decade, it's this color. I think that could work, man.
I like it. Let's do it.
All right. So I'll take the next couple. So other things that are included within memberships within DPC, the idea again is depending on where you're located, these are the ones that are a little bit more nuanced. So one of the things is mobile or house calls. So some DPC practices do this regularly, whereas some do not. So not all will do this, but it is something that can be included. We actually do house calls, and I do them every so often. I'm not doing them every day of the week, and I'm not doing them every week of the month, but I do offer those to patients who are, in essence, as we call it in the church, sick and shut in. So when we have those patients who can't get to us, they're bed bound, they're wheelchair bound, or they have other diagnoses that don't allow them to make it to the clinic, we will go to them. Now, that is something, again, that is case by case and also clinic by clinic, but that's something that can be included. Other things that can be included is access to wholesale prices for things like labs and medications. So again, most clinics will give you wholesale pricing on your labs to where you can pay the clinic, and then the clinic takes that payment and goes and pays the lab company. And when they pay the lab company, that cost savings gets passed on to the patient, because the clinic normally gets a discount. And when the clinic gets a discount, they just turn around and give it to the patient. So that's pretty common, but not always. And then the last one is access to discounted medications in the office. So patient zero, you may know this. In the state of Louisiana, is it possible for physicians to dispense medications?
Yes.
Okay. In the state of Texas, is it possible for physicians to dispense medication?
No.
No. Correct. So that's the one thing that we are meaning when we say it's case by case. Texas
I
cannot
gotcha.
dispense as physicians as of now, as of the recording for this episode, right? 5 years from now, we never know. But right now, the state of Louisiana, physicians can dispense medicine if they get a dispensing license. So I actually have a dispensing license for the state of Louisiana. So not only can I write prescriptions, I can also turn around and dispense the medicine directly to the patient for something that's prescription only. So, of
Yep.
course, when that happens, you don't have to go to a pharmacy unless it's absolutely necessary. Is that something across the country, across every DPC? No. Some DPCs flat out can, they don't want to. Some DPCs prefer to have you go to a pharmacy because they don't want to get their hands involved with that. And then some states will not allow you to do that. So that's a third thing that can be included in the membership, which is access to the dispensing, access to the discounted medications, whereas some will not, right? So those are three others that could be included, but the other four that you mentioned, I think, are pretty good. The last one I'll mention with you, and I know you're going to help me out on this one. There's something that we always try to advertise that everyone gets to benefit from when they make it to the clinic. And I'll give you a hint. This is something, again, that's pretty much standard across the board in DPC, meaning every DPC does this. When you get to the door, usually you walk in, and what do you never have to do when you come to a DPC?
Ask for water. I get the bottle of water every time.
That is not what
But
I
I
was going
don't
to
have
say,
to
my
wait.
friend. No, okay, I was about to say, if you think everybody giving you water, that is a Byja Clinic special. So let's start there. But you hit the nail on the head. What's the second thing you said? Because I started laughing, I might have jumped the gun.
I don't have to wait when I walk in. Normally, I walk in, there is Pandora playing, but I never sit out there because I can go straight to the exam room.
Mm-hmm. Exactly. So to clarify, as Patient Zero is putting it as mildly as possible, none of the patients in DPC, unless something's going wrong or for some reason there's an emergency, none of our patients wait in the waiting room. You literally have the ability to walk into the clinic and usually go straight to the exam room because we're expecting you. And again, we're not booking 4 or 5 people in one slot to where now we're overbooked and we're running behind. So most of our patients will come in and rarely will they sit in the waiting room. They literally walk through and go straight to the exam room. And what do we call the waiting room in a DPC practice? It's called wasted real estate. That's what we call it, because no one typically sits there and it just looks nice, like a museum sometimes. We try to, as Patient Zero mentioned, we try to play nice music to make sure you feel comfortable walking through past the exam room. But most of the time, it really isn't a huge need for a waiting room because no one sits there. Now, Patient Zero, any idea why we don't make people wait in the waiting room? We talked about it last episode, but I just want to make sure you get an opportunity to explain to people why we don't make people wait in the waiting room.
Well, it's a bunch of reasons. Number one, the fridge with the water staying there. That's number one. Number two, you don't want to be in a waiting room with a bunch of sick people.
Right.
Number
That's the main
three,
one.
you have a slot for an hour, and that's your slot. It's not overbooked, so you'll rarely see another patient. Now, unless your appointment goes the full hour and somebody's behind you, you may see another patient in passing, but 9 times out of 10, you probably won't see anybody else while you're there.
Mm-hmm.
So the fact that you've taken the time, have a schedule set where you can dedicate your time to one patient per hour, and you don't want anybody else who's already sick passing what they got to somebody else who's has something else wrong with them, that's not really a good recipe for wellness, in my opinion. So
Correct.
for all those reasons and more, there's nobody waiting in the waiting area.
There you go. And I think, as you said, the most important reason was that's where the refrigerator is with the water, and we don't want people ransacking the actual refrigerator. So that's pretty much what it comes down to.
All you
right?
need is a bottle. All you need is a bottle an hour.
That's it.
You
One
don't
whole
need
bottle.
two.
There you go. And that's why I said we believe in hydrating you. So we always offer you water when you come into the actual clinic. And then when you're leaving, we actually do you want another one because it helps my life and my job when you are adequately hydrated, sir.
Patient zero tip. Drink the water after you hit the scale. Because you'll get on the scale once you get there and you're going to feel bad about yourself. At least I do. Drink the water after. You don't need those extra ounces in addition to what you already got going on.
That whole swig all of a sudden added them 4 extra pounds on you, my friend.
I blame the water, bro. It's the water.
I got to get some diet water. That's what it is.
That's what it is, man. You got to get that low calorie water, man. That sparkling water, man. That's what you need.
There you go. Well, that ain't gonna never happen because if you like coupons, I love them because that ain't gonna happen at all. If you come to my clinic and you get sparkling water, either it fell off the back of a truck or we going out of business. Like this is the last hurrah, my friend. It's never gonna happen. Never.
I got to go back to the traditional people.
Right. You got to go back. This is the, what is it, going out of business sale? That's what it is. If you see we got sparkling water, it ain't no Perrier, it ain't no Topo Chico, it ain't none of that. It's going to be
Hey,
pure bottled water. And I mean, maybe some spring, you might get some spring out of there, but we ain't getting alkaline. We going regular water.
dibs on the exam table, bro.
It can work. It can work. All right.
All
So
right.
we got a few more, not necessarily benefits of being a member, which I think, again, we covered really well. I think it also highlights to the average person who may not know a lot about direct primary care, the things that are included in the membership with the small nuance of, hey, not every practice does the exact same thing. So you may have some practices that include IV hydration, right? They give IV bags of fluid to people when they need it, if they prefer to do that. Some people may also do standard sets of labs included within their membership where a person doesn't have to worry about paying out of pocket for a certain set of labs. Some people may also include cosmetic things inside their actual practice and inside their membership. Some people may do joint injections inside of their membership. So there's a bunch of things that may be added on or not. But the options are, again, direct to consumer. So if anything is included, more than likely you don't have to pay extra. Or if it's accessible, there may be a small upcharge on those things here and there. But either way, we're going to tell you what the price is up front. We're not going to worry about, well, this is or isn't covered by your insurance. We're going to say, this is how much it costs. If you want to do it, let's do it. If not, no worries, don't worry about it, that sort of thing. So that's important. And I think a lot of people need to understand that. So I think the last thing we'll talk about briefly when it comes to DPC, and then we'll potentially take a break, Patient Zero, is the benefit of the model in terms of numbers, right? So we talked about things that are included with the membership. We talked about what the membership is, but we also briefly mentioned that, hey, when you're coming, you're not really seeing anybody else, at least in our practice, because of course we have a model of one person in, one person out for the most part, right? Like rarely will you have overlap with anybody in the same slot as you. So based off of that, let's talk about numbers when it comes to DPC practices. So we talked about it in part one, that the average number of patients in a practice for people inside the traditional insurance-based model is somewhere between 2,000 to 3,000 per physician, which ends up equating to roughly, like you said, those 10-minute visits, even though the slot was 20 minutes long. So based off of that, we're doing the polar opposite when it comes to DPC. So can you give the people an idea of what the practice may average across the board when it comes to DPC? So what is a, for lack of a better term, full DPC practice on average, if you had to take a guess when it comes to the numbers per physician, I
So
would say?
if I had to guess, I would guess between 600 and 800 patients.
Yeah, I would say you're spot on, because when we get to 500, we're pushing it, right? Like when we get to 500 people, we have to keep up with, we're pushing it. So if you get past 500, up to about 600, I'd say that's pretty good. Now, some people may go beyond six up to 800. And I think the reason they would do that is because they may have a practice where they're doing smaller things, right? Hey, I don't necessarily have hour-long visits. I have 30-minute visits. So I'm able to see more people in a day, which allows me not to feel overloaded, overwhelmed. Or I have a practice where I do have a fair range where I have younger patients, so they don't require as much. And then I have patients that are on the older side that do. So so the smaller number of older patients, large number of younger patients, I may not have the strain when it comes to a 400, 500 person practice. All right. So most practices have that number of 600 to 800 patients in comparison to 2,000 to 3,000 patients, Patient Zero. So does that make sense that there's more time and better care when you have less people?
Oh, absolutely. You get to you get more time to focus on your people because you're not caring for all these people at one time.
Okay. And what other thing do you not focus on as much when you are literally taking care of people and not worried about insurance? It's another P word that you're not focused on. No idea?
The another P word that you're not worried about. Hmm.
I'm gonna help you out. It's paperwork. We're not focused on paperwork
Oh,
because, in so
yeah,
many
yeah.
words, we're not literally having to do all this documentation for an insurance to pay us back or reimburse us. So, but
You see,
because
I was thinking charting because
that's true.
you know,
Well, paperwork, charting is one of them, right? The other thing
yeah,
outside of charting is also things like, oh, well, now I have
billing.
to worry about documenting what happens on this lab at this very moment, because in order for me to get that billing done, where we're going to receive reimbursement for the lab, I have to document in this very specific way. So paperwork, whether it's dealing with the patient directly and charting, doing callbacks, sending prior authorizations, things of that nature. We don't have to do as much of that because now that you don't have to go to the pharmacy and argue that the insurance doesn't cover it at this pharmacy, we just dispense it directly to you. The insurance is not involved. That's less paperwork. So that's why I would say we're dealing more with prioritizing people and less with paperwork, that DPC ends up winning in that realm. It also gives us more time to spend with you and your family because we don't have an extra 1,500 to 2,000 people to take care of, because of course we're doing a good job of saying we're only going to have a small panel of 500 to 600 or 600 to 800 patients. So that is the huge point of why the balance is there. And then the last thing I'll mention, patient zero, what do you think doctors get to avoid when they don't have to see triple the number of people in a day or quadruple the number of people in a day? Again, we're avoiding,
Burnout,
I was going to say,
moral
we're
injury.
avoiding paperwork and burnout, right? Burnout to the 10th degree. And do you want to give them an idea of how the burnout ends up being avoided by having less of the stuff and the headaches with the traditional model?
Well, absolutely. You only got a few patients that you're seeing a day. It's less back work on, you know, you're not trying to see 6 or 7 people in an hour. So you actually can have meaningful conversations and you're not juggling patients. You're not thinking of all these different prognoses, diagnoses, things like that. Is you can focus in a lot better, in my opinion.
Yeah, absolutely. I think the other part is that you're not having to deal with the idea of arguing for something that you know to be right, which is the moral injury part you talked about. And we, again, talked about it briefly in the last episode. Moral injury is the idea that people who know something is right morally are not being able to do that. And they're having to watch their people, patients, whatever, suffer even though they know what the answer is and what they need, right? So patient zero needs this blood pressure medication. It's going to help keep him out the hospital, but I'm now having to argue for this person to have access to this medicine, even though I know it doesn't cost that much. It's just somebody doesn't want to pay for it. And because I'm now arguing with this person, I'm now struggling with the patient getting sicker and getting hurt or dying. It's affecting me from a moral standpoint. It's affecting me from an overall ability to do my job standpoint, and it starts to wear me down to where, again, I don't want to do this anymore, right? I'm seeing the ugly face of medicine that now I just want to do something else. I want to do something that makes me feel better and keeps me happy. So now I end up leaving medicine altogether. So the burnout is there, just being exhausted. The moral injury is there because we're consistently just being beat down by a system that really doesn't see people as people. They see them more as numbers. So with us avoiding all that, taking care of people directly, not having to worry about reimbursement and being basically at the behest of an actual insurance company, we feel better. And that's a huge thing. So patient zero, I think we've given the people quite a bit. Now, I'm sure there's more we're potentially missing, but I think at least from a baseline standpoint of what is DPC, what's included within most memberships within the DPC space, the benefits of it from both the patient standpoint and the physician standpoint, I think we've covered quite a bit in the first segment. So anything you want to give the folks before we go on break, my friend?
Oh man, I think we've given them a lot. So after break, we'll give them a good bit more.
I'm going to say this. I'm a little bit disappointed in you, sir. I thought you were going to easily take that as I'd like to give them a coupon. That's what I thought, and that would have been perfect to go into the break. That was what I was hoping you was going to go with.
Nah, man, no Byja coupons. That I know of. And I definitely don't want to be in hot water on you with you promising people discounts to the clinic. So that's not what we go do.
All of a sudden, patient zero is no longer with the with the clinic.
Right. However, if you want a coupon to your favorite store, go ahead and put your email in, and I'm pretty sure they give you 10%.
There you go. There you go. All right. So we will go to break and we'll be right back after this. Hello there. It's Dr. Jasper from the Byja Radio Show. Are you tired of the broken healthcare system? Frustrated by long wait times to see your physician, rush visits, and the sky-high healthcare costs that come with those rush visits? Yeah, I hear about it all the time. So if you're tired of dealing with any of those things, then I highly suggest you check out the book Byja Blueprint, an introductory guide to direct primary care for patients, physicians, and businesses. Written by yours truly, it breaks down all you need to know about direct primary care, a model that makes healthcare simple, affordable, and personal again. The book covers topics like how DPC differs from traditional insurance-based healthcare, what's the difference between direct primary care and concierge medicine, how employers can use DPC to cut healthcare costs, how this model reduces burnout for physicians and improves work-life balance, and so much more. Whether you're a patient, a doctor like myself who was fed up and burnt out, or a business owner tired of rising healthcare costs, this book lays it all out in plain English. So if you're ready for something better, check out Byja Blueprint, available in paperback, audio, and ebook format. Visit bookstoread.com/Byja Blueprint DPC and get your copy today. All right, and we are back from commercial break, and we are talking about part 2 of why America needs direct primary care now, considering all of the foolishness that's going on in the country in terms of the premiums skyrocketing, my friend. So we spent a lot of time in the first segment of part 2 talking about DPC, what it is, things that are included within most DPCs across the country, things that are a little bit more beneficial and slightly different from DPC to DPC. And then, of course, the benefits from a patient and a physician standpoint. So I think the second segment, we'll spend time talking about things that people often want to know when it comes to DPC practices. Specifically, what does it cost? I think that's a pretty standard question across the board, patient zero. So I got some notes together and I shared them with you, my friend. Would you mind sharing with the people, what are the cost parameters? And I use the word parameters intentionally because it's not a one size fits all. If you've seen one DPC, patient zero, what's the next part?
If I've seen
one DPC, you've seen one DPC. That's pretty much the idea, meaning
oh yeah,
they're not
yeah,
all
yeah.
the same. So based off of
They're
that,
definitely not.
So based off of that, the price parameters are going to be different from clinic to clinic, right? So one clinic may have one set, one clinic may have another. But patient zero, why don't you give them an idea of the range that we're talking about?
So the range that I see, I don't think is 100% accurate.
Okay.
It says a flat monthly fee, and it's between $75 and $100 a month.
Correct. And that's the part. This is across the country. This is not data pulled from Byja Clinic and Byja Clinic alone. Our prices are going to be different depending upon where you are. Why am I saying that? If you're in rural Wisconsin, your pricing is going to be a lot different than if you're in a capital city. If you're in Los Angeles, California, it's going to be a lot different than if you're in, Willacoochee, Mississippi. So the idea is that the standard average across the board is somewhere between $75 to $100 a month. That's probably going to change because, as we covered earlier in this season, legislation has recently been put into effect starting in 2026 that the HSA limit for an individual is, patient zero, can you remember?
4,300.
Well, let me go back. HSA for DPC membership. I apologize. That was a horrible question. So let me throw it back to you. How much will the HSA limit be for an individual per month for a DPC membership? How much can you use your HSA for a membership for DPC? Let's see if you remember, my friend. I'm putting you on the spot.
There you are. Was it 150 per month?
150, right?
Yeah.
So it's $150 per month. I knew you would remember. That's why you're patient zero, the all-knowing. Because of that probably is going to shift, right? Because now that HSAs are covering more, why wouldn't the DPC practice say, well, look, I'd like to get the maximum benefit as a small business to have this HSA cover this individual, and we get that membership coverage the way we want. Now, that doesn't mean that everybody's going to go to 150, but if they're previously at 75, they may move it to 100. If they're previously at 88, they may move it to 99. But the standard across the board, for the most part, is $75 to 100. And I'll also go with this, patient zero, and tell me if this makes sense. Different practices who treat different populations have a different range. So if you're seeing extremely complex, very, very sick patients, your pricing may be a lot different than if you're seeing a lot of healthy, younger individuals. Does that make sense?
Makes a lot of sense.
So that's why I said the idea is people will see a video or a seminar and someone will say, well, the average is somewhere between $75 to $100. And the first thing everybody walks in and say, well, I thought it was going to be $100. No one said it was $100. We said that's the average. And the average means that there's some that are a lot lower, some that are a lot higher. And obviously, if you're in a place where the cost of living is a lot lower, they probably won't charge you nearly as much. But if you're in a place like a San Francisco, the cost is probably going to be a lot higher. So you need to keep up with the idea of, hey, let me look and see what our prices are around the area. And if the prices are around the area, somewhere between, and I'm making it up, 125 and 150, then that's the price. It's not, well, so-and-so in Wisconsin or so-and-so in Idaho is $80. Well, that's clearly a different state than where you are, right? That's different.
Sign up in Wisconsin.
There we go, right? So that's why I like to explain that part where it comes to the average. I will say that patient zero, I think you've said it before when we've done presentations in person, that the pricing that we had when we started may have been around where that was. And now our prices have definitely changed and, in my opinion, changed as it should. But when we started, we were somewhere in that ballpark, if I'm not mistaken. And based off of that, it makes sense that it really comes down to each practice doing what's best for itself and not doing what's best for the insurance company when it comes to reimbursement, because an insurance company may decide that you only should get $100, but your cost and your overhead is well over $100. So now you're in the red trying to care for people, and now your business closes. So it doesn't make sense to do it just based on some random number. It has to be based on what keeps the clinic open, allows the physician and the practice to stay in the green, allows them to draw a salary so they can take care of themselves and their families, but then be a whole person when they walk in and not feel like they're getting jaded because they're not getting paid and reimbursed what they're worth, which happens on the insurance side. So patient zero, anything you want to give the folks when it comes to that $75 to $100 average, what do they not have to worry about when they walk through the door when that is paid for the month? Because most people always ask this question for me when it comes down to membership. So what do you think people ask? Do they also have to do this when it comes to those memberships?
Well, when you pay a membership fee for the clinic, there's no copay.
Correct.
There's no deductibles for visits or services that's included. There's no need to file insurance for a visit. Now that there's a disclaimer, patients are still encouraged to carry catastrophic or wraparound insurance if you can for emergency room visits, surgeries, hospitalizations, things like that. But, when it comes to the clinic, your pricing is transparent, predictable, and is discussed up front with you and your doctor.
Yeah. And I'll jump in and say, to kind of put the cherry on top, the idea is that we do want you to have insurance. We're not walking in and saying no insurance because insurance is the worst thing ever and you shouldn't have it at all. Nowhere have you ever heard us say that. We don't like insurance because it is overutilized. We don't like insurance because it turns into a problem for us to be able to give you care the way that we know you need care. We don't like insurance getting involved in telling us what is or what isn't good medical decision making for us and our patients, but we do know it has a place. So what model would you say it's good to mimic if we had to choose a model to mimic patient zero, so that we are doing the idea of the catastrophic or wraparound insurance for those big things? Is there any model you would say this sounds like we are trying to reference or in essence pay homage to?
Well, I would say your car insurance.
100%.
That's an easy way to go. For example, you got a car insurance. This has happened to me because for some reason, my vehicles are always like a target for some reason. I don't know.
Mm-hmm.
But at the time, I I went to New Orleans and best city in America. Not this night though, because my truck was broken into. So I walked out. I walked back to my truck and my front driver's side door glass was on the ground. Right. So I need a new window for the truck. My deductible on the truck was $500 at the time. Right, not a bad deductible, but my deductible was $500 to replace the glass in the truck. It was $200. What do you think I did? Do you think I bothered to call the insurance and risk having my premium to go up, or did I just pay the $200 to fix my window?
I'm gonna go with probably the $200, my friend, because I think it kind of goes with the original part of that. Maybe there was a coupon. No, I'm joking.
There was a coupon at this particular place because if you paid cash, it was cheaper than the card. So I politely went to the ATM.
There you go.
But the more of the story is every situation is different. I've gotten in a car accident before. I used my insurance
There we go.
because I didn't have $15,000 to fix the car.
Correct.
So I went through my insurance and paid the deductible. But the point that we're trying to drive home, every situation, you got to use your judgment on what you need to use it for. You don't use your insurance to put all in the car. You don't use your insurance to put gas in the car. You don't use insurance for new brake pads. Some routine maintenance you just do on your own because A, insurance doesn't cover it anyway, but B, and more importantly, it's just cheaper and more affordable for you to do it on your own. So why isn't health insurance the same way? I'd rather use my health insurance when I actually need to use it versus, having it all wrapped into what you and I discussed.
Mm-hmm.
And I had another situation with another doctor, and I wish everybody did DPC, but I understand some specialists don't, and you still need to utilize these specialists. But I'm gonna give you an example. Conversation I had with another doctor. And I'm not trying to throw him under the bus because I think he was as honest and upfront with me as he possibly could be, and I appreciated that from him. So I have an injury, right? So he referred me to go to physical therapy. I said, Doc, do you think physical therapy is going to help? He said, honestly, no. It's not going to help. It's not going to help at all. However, for your insurance to pay for your surgery, you need to go through physical therapy first. And fundamentally, I had such an issue with that because it's like I'm going through something and I'm paying for something that is not going to help me. However, I'm doing that to get to the surgery, which fundamentally is backwards, is ridiculous to me. But these people who are business majors like myself, who haven't cared for anybody in their lives, is telling the doctor how to care for me, and I just don't think that's right.
Yeah.
Now, I appreciate him for being upfront and giving me the best level of care he possibly could, but it's just a thing. So, I went on that little low key rant. It wasn't a high key rant, low key rant, to say that why do you need the insurance to be in your everyday interactions with your primary care physicians? Just like your car insurance. I don't need my truck insurance for everything on my truck. Some situations, absolutely, I'll need it. But to put gas, to maybe replace a busted window at the Sanger, to maybe put some new brake pads on it, I don't need my insurance for that. So I'm not going to use my car insurance every time I need something with the car. I'm not going to use my health insurance every time I need something with my health. There's other resources, other options.
There you go. And I think, again, you painted the picture as broadly as I would. And I think you also gave people practical examples that we try to highlight whenever they call us to explain to them why we're doing this model and the way we're doing it. if you are using your insurance on the car frequently, for the most part, if I understand it correctly, those are insurance claims. So every time you use your car insurance, you're filing a claim. The problem is of course, in healthcare, we don't think of them as filing claims. We just think we're quote unquote using our insurance and there isn't a claim associated. They're all claims. A copay is a claim. The deductible portion is a claim. Your medication is a claim whenever you use your insurance. The x-ray is a claim. The doctor visit is a claim. So all these claims are being filed. And imagine if that was your car insurance, the premium would go up. It would be very expensive because we're filing claim after claim after claim. So in DPC, we're mimicking, if not trying to move towards a car insurance model. And by doing that, that allows us to file less claims, to move through care more efficiently and more cost effectively. And by doing that, we end up saving people a lot of time and money. And we save the insurance for big ticket items. So patient zero, what do you think one of the major questions we get all the time, or for lack of a better term, one of the objections we get all the time whenever it comes to DPC, when it comes to direct primary care? Well, it doesn't cover hospitalizations. Well, it doesn't cover surgeries. Well, it doesn't cover my specialist. Where does it say direct all-inclusive care? It doesn't. It's primary care. So you're paying a membership for primary care. You're not paying a membership to cover your specialist. Now, if a specialist wanted to jump in and bundle it somehow with the primary, then I'm sure the name would be different. And then we would tell you that on the front end that when you pay for this, this specialist is included. But for the most part, direct primary care is primary care, and there aren't specialists included. So no, your membership doesn't cover that. The direct primary care is primary care. There's not hospitalizations included. So no, it doesn't cover that. And then, of course, x-rays, imagings, meds, none of that is included in primary care. It's not included right now. Your x-ray, you may think it's included in your primary care because the primary care physician orders it, but usually you're not doing that in the primary care physician's office. You're going to a radiology suite or you're going to a hospital. So that's a different service, a different place. So primary care doesn't cover that either. But people keep doing that as a naysayer of, well, it's not all inclusive. And we had a segment, Patient Zero, and I don't know if you remember, you were going to be in the segment, but you couldn't make it that day. And with the segment, the news anchor came and basically said, and I quote, well, tell me about DPC and all the things that it includes. And we did the exact same thing. It's on our website, literally is on the homepage. And in the segment, there's a small portion that always says, well, it doesn't include hospital stays. It doesn't include surgeries. And it's always the objection someone comes up with because it doesn't do everything. And again, I don't think health insurance does everything right now. They may claim that they cover everything, but to my understanding, they don't. So why are we being compared to a bad system and expected to do the same thing they do, but do it somehow better with less payment? When you're paying more for premiums, you're still getting less. And now you're paying less for a membership, but you want more. Like, it doesn't make sense to me.
Well, it's a lot that I can say about that. Let me start by saying this. It's direct primary care, to like what you said, right? So it's never a point where I've been on this show and I said, don't get insurance. My complaint was insurance getting in the way of you and I making a plan for my care.
Yes.
That's what's irritating to me. I never said don't have insurance. If anything, I've encouraged you to keep your insurance. So for me, what I've done, I looked at the model, and every year I go to my open enrollment and I look at what I got. I always do a higher deductible plan to lower my premiums because I'm paying the membership fee and I come out. So it's a better way to get care, right? However, I'm gonna use an example like the car example, right? If I'm going to the place that changes my oil, I'm not going to ask them to fix the crack in my windshield.
Mm-hmm.
If I'm going to the place that fixes the crack in my windshield, I'm not asking them to fix my exhaust on my truck. If I'm going somewhere to get the exhaust fixed on my truck, odds are I can't buy tires there. If I'm going to the place where I bought the tires, odds are there's not a drop of gasoline in that place. You go to all these different places for your car, you got to go different places for your help. And honestly, and if you were in the traditional system, you go to your primary care doctor, he's going to write you a referral for everything. You tell your doctor your stomach hurt, you're going to get a referral to the GI doctor. You tell your doctor your toe hurt, you go get a referral to the podiatrist. You tell your doctor, your head hurt, he might send you to a neurosurgeon. I don't know. But what I'm saying is, in the traditional model, you're going to go everywhere anyway.
Mm-hmm.
It's not really that different in direct primary care. The full benefit of direct primary care and the biggest draw, in my opinion, as a patient, I have more time with my primary care doctor and I can get a higher level of care because we are talking about multiple things. If I'm coming to see you about a stomach ache or whatever, we're also going to talk about last time I saw the optometrist. We're going to talk about last time I saw the dentist. We're going to talk about, okay, you have upcoming labs, because I get labs once a quarter, and we go over those labs. We go talk about in a previous injury. We're going to talk about my weight. We're going to talk about all these different things that paint the whole picture. So guess what's probably not going to happen to me? I'm not saying it can't happen, but guess what's probably not going to happen to me, Doc? It's probably not going to be a catastrophic event that's going to happen to me in terms of my health. Now, I'm not saying that I can't get an injury somewhere,
right,
as a result of something happening, but the chances of me having a heart attack or me having any type of catastrophic sickness or me having to go to the emergency room versus somebody else who's not in the clinic, I'm betting that my chances are a lot lower than the average person or the person in the traditional model, because we've already addressed all those parts of my health that go undressed when you're not in care or when you're only getting care on one particular thing that you chose to go see the doctor for that day.
Mm-hmm.
Right?
Yep.
That is the benefit. So if you're doing all of those things, then your need to see the specialist is probably going to be a lot lower anyway.
Yep.
So there's a place for it, but using the excuse that your membership fee doesn't let you see a specialist, it doesn't let you do this, it doesn't let you do that, you're looking at it the wrong way. The membership fee is an alternative route to get a higher level of primary care.
Mm-hmm.
You still need to keep your insurance if you got access to it. If you don't have access to insurance, then I would try to get some access, but there's still a benefit of paying the membership fee and getting the direct primary care. But if you got employer insurance, all we're saying is crunch the numbers, make sure you got something in case you need to go to the hospital, in case you need to see a specialist. But you're probably not going to need the quote unquote good insurance, like we like to say, the high premium, low deductible insurance.
Yeah.
Get you a cheaper insurance that has a higher deductible. And with that, I'm going to get off my soapbox.
Yeah. And again, I think it begs the question, why do people try to somehow defend the system that everybody knows is bad because they feel like this new DPC system isn't doing everything to fix the old system? Well, first and foremost, we never claimed that we want to fix the old system. We're never claimed that we are going to be the one size fits all for everybody. It literally
We've
comes
only
down,
claimed to be an alternative.
Correct. And we did that in a way to say, let us try to give you something. You can clearly stick with where you are. If it's a bad system, do that. Stick with them. If you love it, then great. Or as our folks say, if you like it, I love it. But we're not going to sit here and tell you that DPC is the one size fits all saving grace superhero that's going to swoop in and do everything. We're not going to pay one membership a month and cover 12 doctors. That makes no sense whatsoever. If you really think $100 is going to go between a hospital, a clinic, a specialist, an x-ray suite, and a lab company and the pharmacy, then you done found the best plan in the world. And I think you definitely want to keep that. But we never said it would. So when we hear that, my thing is, I don't understand why we have people who are somehow married to the idea that we are going to somehow be the thing that fixes everything. But more importantly, you're defending something that's broken and you know it's bad. The last thing I'll say about that is that people tend to think that if somehow we were to do all those things, their care is just going to magically get better. It doesn't work that way, because even if we did cover hospitals, x-rays, specialists, you still got to do the work. You still got to come to the office. You still got to eat right. You still got to do that. So to lower your risk is better by getting into primary care, staying in primary care, and being consistent in your primary care than not doing that and just saying, well, I don't want to do a membership because they don't cover all this stuff, so I'm going to just sit on the sofa and complain. Don't make sense. It's only going to get worse. So how about you get off the sideline and try to actually improve your health and maybe give us a shot, or give the direct primary care practice a shot, and not sit there and think that, well, it's not doing all the things that the traditional one should do. And I wanted to do everything. Okay, well, it ain't for you. We get it. But for the majority of people who are listening to this, it is something that you are considering. Maybe listen to us and say it can work. And once you learn how to use it, along with the wraparound coverage, along with that catastrophic coverage, or that low premium, high deductible coverage, and mimic the car insurance model, it will make a difference. And of course, if you have no insurance whatsoever, this should be a no-brainer. You don't have anything. It's better than just walking around and hoping nothing happens to you. It's literally better to say, hey, let me go ahead on and just get into care. And I'll say this as a quick tangent. I had a consultation, which is our version of meet and greets. We try to do a meet and greet with everybody before they join the practice, because our goal is to make sure it's a good fit for them, it's a good fit for us, and they understand how the model works. So a guy called last week. He literally is like, man, I'm looking for a new doctor. Do y'all, are y'all taking new patients? I said, yes. Let me tell you about direct primary care. I said, we can set up a meet and greet. Let's do that. And then, of course, if you are able to listen to us, have that conversation, and it's a good fit, let's move forward. So the meet and greet was today, patient zero, the day that we're recording. The meet and greet was a phone call. So we do it virtually. We do phone calls, we do in person. So I called the gentleman, and the gentleman answers the phone. He said, hey, Dr. Jasper, thank you for giving me a call. I said, hey, man, no problem. Did I catch you at a bad time? Where do you think this patient said he was for this consultation?
He was driving. He was
That would
now going somewhere down the road.
That would have been great. He was in the hospital. Guy is literally taking the call from his hospital bed. So in a week's time from him, and it wasn't really a week. I think he called on Thursday, and as we're recording, it's on Monday. So within less than a week, the dude said that somehow he basically got really sick, and basically his kidneys started shutting down, and he's now hospitalized trying to figure out if he's going to go on dialysis, because he had a primary care doctor that he couldn't get in to see. They recommended he go to a nephrologist, and the nephrologist, of course, could only do so much because he's a specialist and he's not doing all the primary care stuff. And now his kidneys are starting to potentially shut down, and he's now swollen full of fluid. And now they're having to potentially get fluid off of him to see if his kidneys are going to start up again. And that's his consultation. And he's like, man, I wish I would have known about this years ago. He has insurance, and it still doesn't matter. And my favorite part, his hospitalization, quote unquote, is covered. What difference does it make? Because at the end of the day, had he had good primary care, he wouldn't need that stuff, which you just had. Correct. You just said if you have great primary care, you don't really have as much of a risk for hospitalization. So the wraparound catastrophic coverage should be there. But if we can keep you out of the hospital, where you don't have to do your meet and greet in the hospital, that's the whole point. And I think that's a huge thing.
That's
so
wild.
It really is, because I was thinking he was going to say, oh, man, I'm driving. Oh, man, I'm at the house, or I'm just getting off from work. Dude's like, man, I'm in the hospital. And I don't know when I'm getting out, but I definitely want to go ahead and sign up and come see you once I get out the hospital. And I say, yeah, man, anything you need, we'd love to help. And his one question to me, I said, do you have any questions? Because we did the whole consultation. We did the meet and greet. I answered as many questions as I could about direct primary care. One question that's going to possibly spook you, patient zero. Dude said, and I quote, how good are you all at your clinic from keeping people off dialysis? That was his question to me. I was like, any questions about DPC or, our practice? His question was, how good are y'all about keeping people off dialysis? Like, that's what he's more concerned about. And there's nothing wrong with that. But that kind of shows you how late we are at getting people into primary care. And as we're telling people about DPC in this episode, we still got people who are not convinced that I need to give this a shot. It's like, well, let me think about it. Let me think, well, I'm going to crunch the numbers and it's an extra $10 that I can't afford. Okay. But I think your kidneys may be worth $10. That's just me.
I'm about to say, I'll squeeze out that 10.
There you go. So I got a few more things for you, patient zero. And then again, I think we're going to close out because I think we're doing a good job of just painting a picture of how direct primary care works and why people should consider it. So we're going to do some myths that people tend to have when it comes to DPC. Myths are basically the idea that these are things people have heard and they believe them to be true. And we're going to hopefully paint the picture of whether or not these myths should be somewhat thought of in a way like, okay, well, that's possible, or just flat out like, no, this is wrong. So patients here, I'm going to give you a few of them. And I want you to tell me if it's completely false, mostly false, based on some truth, anything you think of that may be helpful for the general population. So the first myth that we're going to talk about, direct primary care is only for the wealthy. So we know it's a myth. How much of a myth is this, would you say?
That's definitely a myth because coupon loving G over here is definitely enrolled in direct primary care. I don't know how wealthy you think I am, but that's 1,000% a myth.
Right. And I think the other part that I will drive the point home, we won't go into a ton of detail. I did a lecture at the DPC Summit this past year about how we at Byja Clinic and Byja Charitable Alliance work within the nonprofit space to offer a patient assistance program for patients who can't afford memberships, because we have some patients and some donors that are really, really, really caring to basically donate to our nonprofit to cover the cost of people who otherwise wouldn't be able to afford primary care through this model. So we have found a way to offer this to people who are not wealthy. But my colleague who's in Wisconsin, which is why I say Wisconsin quite a few times, she is a doctor who has literally found a way to deliver care in a similar model without a nonprofit, where people literally will come in and pay her with whatever they have. She literally said during the earlier part, I believe, of 2024, if not 23, eggs were so pricey that the people couldn't afford their membership. They came and paid her with 3 dozen worth of eggs. And she took them, right? Because in her mind, she wasn't worried about necessarily reimbursement. She was worried about her patients, and her patients said, look, I can't pay you, but I'll do whatever. And she's like, that's no problem. We'll make it work. So the idea that you got to have insurance to get great primary care, you got to be rolling in dough to get great primary care. And more importantly, you can't do it if you have fill in the blank. It's completely false. We have patients who have Medicaid. We have patients who have no insurance. We have patients that have catastrophic only insurance. We have patients who live check to check. We have patients who pay every other check to do it. It literally is, we're going to find a way to make it work if you really wanted to. But if you walk in and think, well, I'm going to pay my favorite, next to nothing, get amazing luxury car service, but you paying Uber money, I don't know what you think this is, but I got to feed my family just like anybody else. And more importantly, it doesn't make sense for us to drive ourselves out of business trying to basically race to the bottom because you don't want to literally take your care seriously. It makes no sense, whatever. So all that being said, DPC is not only for the wealthy. That is a huge, huge fat myth that a lot of people think, but hopefully we're bursting that bubble. So myth number 2, patient zero. We already have talked about it, but let's just be quick on this one. Direct primary care just covers acute issues, or it just covers chronic issues, but it doesn't do both. What do you think about that?
I think that's also a myth. It depends on what you call a chronic issue, because I think high blood pressure could be a chronic issue, and
100%. It could be an acute issue.
And if you don't, I'm about to say, and if you don't think it's could be a chronic issue, leave it alone to see what happened to you. You know, like, so I would say that that's also a myth.
100%. And the idea is that in our practice, we take care of the runny nose, the sore throats, the injured knees, the falls where you bang your elbow or you cut yourself. And then we also do the long-term things, diabetes, high blood pressure, even dialysis, heart things, right? People with pacemakers, people with issues with lung disease. We take care of all that. The goal is to basically get you into care to hopefully keep you from having to go into a hospital and hopefully having not to go to a specialist. But if you got to do that, then we will. But the goal is we want you to be in care, and we take care of all things at my practice, and other DPCs across the country do it as well, right? I don't think it's going to be any mystery that we do primary care, which includes acute and chronic issues. All right, patient zero, we got about 3 more, my friend. So next one, which I think is going to be a favorite of yours. This one is you can't use health insurance at all if you're in a DPC practice.
That's also false.
Well, we know it's false, but how false do you think it is?
Oh, it's I guess I'm gonna go with 50% false
Okay.
because you can't use it for your visits. So which
Talk
is
to him.
true,
Talk to him.
but you can't use it for your visits. But if you got labs, you're more than welcome to use it, even though sometimes it's cheaper without it. You got prescriptions. Sometimes it's cheaper without it too, but you can use it on your prescriptions. You can use it on if you need any type of imaging. So there's different things that we can do that uses insurance, but you can't use insurance for everything. So I'm gonna just say it's about 50%
Yeah,
true.
and that's the misconception. People think, well, if you're in DPC, it's no insurance whatsoever, or you're not in DPC and it's insurance all the time. Well, the second part of that is true. If you're not in DPC, yes, you're probably going to have to use insurance for all of your stuff. Rarely are you going to walk into a non-DPC practice and they're going to give you a discount where you know what the discount is upfront, and that's the only option, so to speak. They want you to have insurance in a lot of the practices because that's how they operate. With us, we give you the option that if it's cheaper to go without insurance, then we recommend doing that. But if insurance is going to give you a better benefit, then we recommend doing that. So yes, you can use insurance if you have it in certain settings, but within the 4 walls of our practice, what we tell people is most of those things are going to be direct patient to consumer. Patient to clinic, and then clinic to consumer or clinic to patient. All right. 2 more of patient zero. This is my second, if not maybe most favorite misconception. So I want to know if you believe this is a huge, huge falsehood or something that's slightly false. DPC is a new model that hasn't been around for very long.
I think that's false.
Okay.
I've been in the clinic with you at least 5 years, and you didn't invent the model.
Correct.
So
Even though I've had people literally ask me, well, how did you come up with this? And I'm like, I wish I did invent it because I would have definitely cashed in, but it's not something that's
right.
very new. DPC has been around for a while. Patient zero, any idea when the quote unquote first DPC model, clinic, whatever you want to call it, started? Now, I'm going to give you a hint. It's not before you were born. So
No, it's not. Okay.
it's not, because I know some people get confused. It's after you were born. So that's your hint. Any idea when the first DPC clinic was founded?
I'm going to go with 1988.
I'd say you a little bit early. It's 1997, my friend. So in 1997, and I believe it's in Seattle, if I'm not mistaken, the practice was founded with the concept of we're just going to basically let patients come in, see us, pay us, and we're going to give them care. To hell with insurance for the most part. And the person who founded it, we did a segment on that person in the book, but the idea is that it's been around since 97. So last I checked, since it's been around since 97, that means we're going on how many years, patient zero?
That'll be 29 next year.
Correct. So something being around for 29 years isn't new in my book. If I say I got 29-year-old fill in the blank, more than likely you're not going to say, oh, that is so new. You're going to say it's fairly new, or okay, it's been around a while. So the model is proven. It's not going anywhere.
Yeah.
And
I'm
as
about to
of
say,
the year,
there's no iPhone 29. There's
correct.
iPhone 17.
Correct. So it's been around quite a long time, and people tend to get this. I don't know, man. Like it sounds too good to be true. It sound too new. It's just new to you. It's been around a while and it's not going anywhere. And I believe when we wrote the book Byja Blueprint in 2024, when we put the book out, there were approximately 2,300 practices across about 48 states. 2,300 practices, right? Now, that means that it's not 2,300 doctors, it's 2,300 practices. And I mean that to say some practices may have 10 doctors, some practices may have one. So we have a range of people in different types of DPC practices and setups that are proven and not going anywhere. And as Patient Zero alluded to, we've been open for 5 years as of September 2025. We started in September of 2020 when we first opened our doors. We're 5 years in, and again, I'm not slowing down. We're only getting better. We're not going anywhere. So the idea that we in the DPC world are new and untested is just completely false and something people just need to get over. It's just fancy to me that when people hear it, they're just shocked and awed. And it's like, we've been doing this for 29, almost 30 years. You might want to get on board, people. All right, very last one, Patient Zero. My probably favorite one, if not second favorite one. You probably know this one, but I want to definitely make sure we cover this myth. DPC and concierge medicine is the exact same thing.
Despite not knowing what concierge medicine really is, I'm going to go ahead and say that's false.
Okay. How false do you think it is, my friend?
It's all the way false.
All the way false. Okay. So I'll give the concept of what concierge medicine and DPC are actually very similar in a concept standpoint. But once you get past that concept, they're very different. So concierge medicine is usually membership based, where people pay a fee directly to their clinic to have enhanced services. Okay. So they pay a fee directly to the clinic to have enhanced services. That's pretty much the similarity, and that's it. The things that then come with concierge is that every concierge practice, for the most part, I'd say 95 to 98%, maybe even close to 99.9%, all of them require you to keep insurance. So at this point, as I tell you that, Patient Zero, I want you to think about that. You are paying a membership and you have to keep insurance. And then when you come up to the clinic, I'm going to not only take your membership money, but I'm also going to bill your insurance at the same time. That's the difference between concierge potentially and DPC, because in DPC, we don't care if you have insurance. If you do, it's a bonus. If you don't, then we're going to keep it moving and still do the same thing we're going to do. But in concierge, you're going to still need insurance, and we're going to use your insurance just like if you were in a traditional model, and you owe us a membership as well. The other part of concierge is that they tend to do their memberships in bigger, wider chunks. So instead of it being month to month, it's usually quarterly, sometimes even 6 months at a time, and sometimes annually. One of the local doctors in Baton Rouge recently switched from a traditional model, and that person is going into a concierge practice, and that person's membership costs, separate from their insurance, their membership costs is literally you have to pay 3 months up front. You don't get the option to pay month to month. So the idea of concierge is very similar in theory, but beyond the similarity on the very face of concierge, it's drastically different. Literally, if you lose insurance in a concierge practice, can you still be a member of that practice, Patient Zero, do you think?
Nope.
Okay, if you lose insurance in a DPC practice, can you still be a member?
1,000%.
Can you change insurances in a DPC practice and not really worry about losing your doctor?
Yep, because I've done
it. And my last one, if you decide that you just don't want insurance, like I just don't want it, I can't afford it, it's a scam, whatever your choice is, you just don't want insurance. Can you still get a DPC doctor?
Yeah, 1,000%.
In concierge, that's not the case. Again, the majority of concierge practices, right? They will literally require you to keep a certain type of insurance. And most of the time, the insurance is not Medicare or Medicaid. It is a private insurance and a membership. So they're usually not seeing the underserved. They're usually not seeing the elderly. And if they are seeing the elderly, usually it's an elderly person with a private insurance policy, not a Medicare. And they're definitely not seeing people who are on Medicaid. So with uninsured, underinsured, or elderly, they are usually not in concierge practices. All of those people and private insurance are in DPC practices. So that's the huge myth that we get. I've had people say, "Oh, I've heard about you. You a concierge doctor." And I'm like, not really. Similar, but not the same. And they'll walk away thinking concierge and DPC are the same because they both, quote unquote, have memberships. They're not even similar whatsoever. So that is a huge myth that we always have to bust. And I'm happy that we got a chance to do that on this episode. So Patient Zero, I think we've been going quite a long time talking about DPC. There's still so much more we could talk about. But again, I think we can highlight confidently that people know this model to be proven, a good model for not only the patients, but the doctors. It's a cost saver. It's a time saver. It's more efficient. It's transparent. And more importantly, it really prevents burnout and moral injury. And I think if people really gave it a chance, took that deep dive, crunched the numbers, as you say, they would do better. But that's just my thoughts. What are your thoughts, my friend?
Well, it's kind of the same thing. Crunch your numbers and use all your resources that you have available to you. The problem is we don't do enough research when it comes to like healthcare. Use all your tools, right? If you have access to FHA, FSA, HSA, use those things. Health spending accounts, flexible spending accounts. Crunch the numbers. See how many times you went to the doctor last year.
Mm-hmm.
You don't need everybody don't need the lowest deductible plan. Like if you're a sickly person and you've seen a bunch of specialists, okay, cool. But if you're not, don't use it. Don't get it. Look into DPC, because sometimes you don't want to pay that membership fee, but the difference in the plans, I saved money when I went to the DPC model. Just me personally, in my situation. Now everybody's situation not gonna be the same, but even if it costs you a little bit more, like how much is your health worth? Like what are we even talking about? Like I remember when I was a kid, the thing was you couldn't buy Walmart shoes. I'm gonna tell this little quick story. Like obviously I'm a big Saints fan, and my mom and dad brought me to Walmart one day, and I saw these Saints tennis shoes with the helmet on the tongue and Saints on the side, and I had to have these tennis shoes. Man, I went back to school and I got ripped. But GP buys tennis shoes from Walmart. Like they clowned me. Like they clowned me so much the way I was traumatized, right? In 4th grade. So, it's almost an expectation that we can't be cheap with our clothing. You have to pay more for good quality clothing, name brand shoes, because this is just where we are in society. Even if you end up paying more for a direct primary care model, why can't we pay more for good healthcare?
Mm-hmm.
Or more for something that benefits us in the long run, or something that keeps us out of the hospital? Even if that's the way it works, because in every case, it's not necessarily going to be more, right? But even if it is more, invest in yourself. Like I just don't understand this way of thinking when it comes to healthcare. So I guess my PSA is change your way of thinking. Open your mind. Look at something that you've never done before. I'm not saying you have to go direct primary care. That may not work for you, but entertain it. Crunch the numbers. Have a free consultation with the DPC doctor. Call Dr. Jasper. He'll do a free consultation. Discount code patient 0, and it'll be free. I promise. Just check it out and see, and just try something different, because you're going to get a better result. That's all.
Yeah, man. And I agree with everything you're saying 1,000%. And I think the other part that I'll just drive home for my PSA or my closing thought is that a lot of people are pleasantly surprised when they get a level of care that they haven't seen. And what I mean by that, and I'll make it short and sweet, if you go to a restaurant that has given you amazing service and you're not used to getting amazing service, you're just blown away by how attentive they were, how they didn't miss anything. how anything you had a question about or a need for, they address that need. It makes you feel better when you leave that restaurant when you have that experience. So in our space, we're trying to do the exact same thing. In the DPC world, I guarantee that you will have an experience 99% of the time that blows away any traditional primary care model you've experienced, because most of us know the traditional primary care model is bad. And if not bad, it's broken. And if it's bad and it's broken, why do you keep having an affinity to stay in that traumatic relationship? Give us that opportunity. Let us give you that 5-star experience. And once you see it, you're going to say, you know what? I'm glad I made that decision. I'm glad I took the leap, and I'm never going back. With that, patient zero, let's close out. Oh, I see a finger. What we got, patient zero?
I got one more point. So I'm gonna make it just to drive that point home. Once I went to the direct primary care model, do you think I got a better level of care in this model? What do you think?
I'm going to say yes.
So just so the people know, do y'all know who my primary care physician was before I came over to the model?
They should if they've been chronic listeners.
My primary care physician was Dr. Byja Jasper in the traditional model.
Correct.
Now, me personally, I was skeptical on this whole thing. And I was just like, bro, I don't know about this, man. I don't know what you're talking about. But I got to the point, I was like, you know what? If this is what I got to do to see this dude as my doctor, then this is what I got to do. So I'm gonna give this thing an opportunity. And I got a better level of care in the model with the same doctor.
Mm-hmm.
Because why, doc? You wasn't seeing 50, 60 people a day.
Mm-hmm.
You had time to talk to me and go an hour in an appointment. You know what I mean? Like, so my point is, if you don't think you're going to get better care, I'm letting you know you will get better care because I got better care with the same person.
Mm-hmm.
So I'm gonna just let that sink in.
There you go. Well, with that, I will go ahead and start closing us out. Patient zero will get the final word. And then, of course, we will look forward to seeing you back for our next episode. You can find us at Byja Clinic, www.byja.org. And then that is the clinic website for the Charitable Alliance, our nonprofit partnership website. That's www.byjaca.org for Byja Charitable Alliance. You can find us on LinkedIn at Byja Clinic, and then Facebook, Instagram, also all one word at Byja Clinic. Please, if you have not done so, check out the Byja Blueprint book. It's an introductory guide to direct primary care for patients, physicians, and businesses. And more importantly, subscribe, follow, like, comment, give us a 5-star rating, all the things that we know you would love to do because we're doing a great job. And if you're listening this far, again, you're a real one. We'd really appreciate you, but please do that. Patient zero, where can the people find you?
Man, they can find me on Twitter. I'm still calling it Twitter at George_Becknell. You can find me on LinkedIn, George Becknell II. And you can find me on Instagram, which I'll do a better job with, at Becknell Media.
All right, people. Well, again, we appreciate you. Patient zero, do you want to tell the people when they can expect to see us next time?
I'm saying a week.